Hi everyone, today we're doing a level 1 neurotoxin treatment. When you're first starting off with neurotoxin, I highly recommend marking up each one of your patients. This is just going to give you a better understanding how different each patient can be and really just give you the time to assess your patient fully and come up with their dosing and really just appreciate their anatomy. So of course, once you get comfortable, you don't have to mark up anymore. But like I said, when you're first starting off, I do highly recommend because you're not going to have a standard marking for every single person. You're not going to have the same amount of ejection points across the frontalis or for the crow's feet, things like that. So it is nice when you're first starting just to give yourself a nice visual before going in and injecting. So I cleaned my patient up prior to marking, so she is nice and clean here. And I went ahead and drew up my neurotoxin, and now I'm going in and treating. So as you can see, it is pretty easy just to come all the way across that frontalis. I like to start at one lateral border and then have the patient turn with me. That's just my preferred way of treating. If you want to switch sides of the chair, you totally can as well. It's really important for you to be comfortable when you're injecting, again, especially when, this is level 1. So when you're first starting out, you want to just make sure you're comfortable. It's going to make your patient more comfortable as long as you feel confident in your injections. And it's going to make the treatment just a lot more enjoyable. So you don't have to copy something that you see every injector doing. You kind of just come up with what works best for you. So now I'm going in and treating the procerus. So I like to do a light pinch and just hold that muscle up and isolate. And then I go in and place my toxin. Then for the corrugators, I like to do a similar thing. I just do a light pinch and go in and place. This is just to visualize and isolate that muscle. You don't have to squeeze up. It's not actually preventing it from going anywhere, maybe slightly, but if you are in that correct muscle, that toxin isn't going anywhere. So we just kind of go through and do the same thing on both sides. Always keep in mind that that frontalis does lie underneath each corrugator, so you want to make sure you are going in at the appropriate depth. This is actually a level 2 injection that I just did. I did a little bit of a lateral brow lift, and then we'll go in with a slightly more medial brow lift. But here we are just going through and treating this patient's crow's feet. For her, I have 4 different injection points there, including that lateral brow lift, or actually not, 4 injections for my crow's feet, and then 2 injection points for my brow lift. But that just goes to show that every patient is slightly different. So it's really about assessing each person. Also for crow's feet, you might have different injection points on each side. So especially sometimes on a patient's left side, just because that's the side that we drive. Sometimes they do need a little bit of a higher dosing or maybe an extra injection point. It really just depends. So these injections are pretty superficial. So I'm going in maybe just slightly past my bevel here and placing my toxin. And I have the patient animate as I'm going along, just to double check to make sure that I like each one of my injection placements. And of course, we're not injecting directly through the marker, always just slightly next to it. And that's my last brow lift there. So just go ahead and clean the patient up. I always wipe up and away just to ensure we're not rubbing that toxin anywhere where we don't want it to be. And that's it.